If you've been referred to a rheumatologist or you're thinking about booking an appointment, you're probably wondering what actually happens. Will there be lots of tests? Will you get a diagnosis straight away? And what should you expect? In this video, I'm going to walk you through exactly what happens at your first rheumatology appointment so you feel informed, prepared and confident. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start from the beginning. Before you even arrive at your appointment, it's helpful to have a sense of your symptoms. In rheumatology, one of the most important things we look for is patterns. It's not just about whether you have pain, it's about how that pain behaves. You might be asked when your symptoms started, whether you are getting better or worse, whether you experience stiffness in the morning, and whether multiple joints are involved. Even simple details like this can be incredibly useful in guiding the diagnosis. When the consultation begins, the first part is usually a detailed discussion about your symptoms. This is often the most important part of the appointment. I'll ask questions such as where exactly the pain is, how long has it been present, whether you experience morning stiffness, whether you've noticed any swelling, and whether you have symptoms like fatigue or feeling generally unwell. We also look at your broader health. That includes your past medical history, any medications you're taking, and whether there is a family history of autoimmune conditions such as rheumatoid arthritis, lupus, or psoriatic arthritis. In many cases, this detailed history already gives us strong clues about what might be going on. In fact, in rheumatology, the history often points us in the right direction, even before any tests are done. After the discussion, the next step is the physical examination. This involves carefully assessing your joints. I'll check for swelling, tenderness, and range of movement. We often focus on specific joints such as the hands, wrists, knees, and feet, because these are commonly affected in inflammatory conditions. Sometimes the signs are quite subtle, and part of the role of a rheumatologist is to detect early inflammation that may not be obvious. One of the most common questions patients have is whether they will get a diagnosis straight away. In some cases, the answer is yes. If the pattern of symptoms and examination findings are very clear, it may be possible to make a diagnosis during the first appointment. However, in other cases, we may need further information before reaching a definite conclusion. Rheumatology is about putting together multiple pieces of information rather than relying on a single test. Depending on your symptoms, we may arrange investigations. These often include blood tests to look for signs of inflammation and specific markers associated with autoimmune disease, such as rheumatoid factor or anti-CCP antibodies. We may also arrange imaging such as X-rays or ultrasound scans to look more closely at the joints. In some cases, an MRI scan may be considered. It's important to understand that while these tests are helpful, they don't tell the whole story. A diagnosis is based on the overall clinical picture, including your symptoms, examination findings, and test results. Once we have gathered all the necessary information, we then discuss the next steps. This is a key part of the appointment. The aim is that you leave with clarity. You should understand what we think is causing your symptoms, what further tests, if any, are needed, and what the plan is moving forward. If a diagnosis is made, we will discuss treatment options. Treatment in rheumatology is very much tailored to the individual. It depends on the condition, the severity of symptoms, and your overall health. In many inflammatory conditions, the goal of treatment is to control inflammation, relieve symptoms, and prevent long-term joint damage. This may involve medications such as anti-inflammatory drugs or disease-modifying treatments like methotrexate. In some cases, more advanced therapies such as biologic medications may be considered. One of the most important principles in rheumatology is that early treatment can make a significant difference. Starting treatment at the right time can improve outcomes and in some cases even lead to remission. You might be wondering whether you need to prepare anything before your appointment. You don't need to do anything complicated, but it can help to have a clear idea of your symptoms, knowing when they started, how they have progressed, and whether anything makes them better or worse can be very useful. It's also helpful to bring a list of any medications you are taking and to mention any relevant family history. Another question that often comes up is the difference between private and NHS rheumatology care. One of the main differences is timing. In private practice, we're often able to offer faster access to appointments and investigations, which can be particularly important when early diagnosis is needed. We also tend to have more time during consultations to explore symptoms in detail and discuss treatment options thoroughly. Many patients also have concerns about what a diagnosis might mean. It's completely natural to feel worried about the possibility of a long-term condition or the need for medication. The important thing to remember is that treatment options in rheumatology have advanced significantly. We now have very effective ways of managing these conditions and improving quality of life. Decisions about treatment are always made collaboratively, taking into account your preferences, concerns, and overall health. To summarize, your first rheumatology appointment typically involves a detailed discussion about your symptoms, a focused physical examination, and if needed, further investigations such as blood tests or imaging. The aim is to provide clarity, reach a diagnosis where possible, and create a clear plan for managing your symptoms. If you've been experiencing persistent joint pain, stiffness, swelling, or fatigue, it's worth getting a specialist opinion. Early diagnosis and treatment can make a significant difference. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms and would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.